All right, everyone. Thank you for joining us for this episode of Pharmacy Pathways. Today, we are going to be going into the world of independent pharmacy practice, and we have with us here today Dr. Keiko Bury, and she is representing not just independent pharmacy practice, but also what it's like to be owner of an independent pharmacy. She has so much information to share with us. So without further ado, I introduce to you Dr. Keiko Bury.
Thank you for having me.
Thank you for joining us. I'm really excited to get into your story and the perspective that you have. If you don't mind, could you please introduce yourself a little bit about who you are and your pharmacy?
Yep. So I'm Keiko Bury. I have been in independent pharmacy practice since about 2003. Right now, I'm the current owner of Carver Family Pharmacy in Carver, North Carolina, right down the road from UNC Eshelman School of Pharmacy, Chapel Hill. So we do a lot of work with students over there, and we're just a small single pharmacy location. My space is about 900 square feet, so really small scale. We're not a big organization at all. And, just doing small things in our community and pharmacy practice to the top of our license. And that's it. At least I think that's it.
That's modest, but we're going to get into everything that you do. And you have about 20 years of experience in independent pharmacy
Mhm.
practice in general, and then about approaching 7 years of ownership. Can you tell us a little bit about your story? How do we get from cashier to owner? Can you tell us a little bit of how that went?
It's wild to think back on my story like that. But yeah, so I didn't grow up in a family of pharmacists, not even college educated. Parents, I'm first generation college grad. So really like for me to even go to college, I think is a big accomplishment for myself. But yeah, out of high school, I didn't really know what I wanted to do. Didn't apply to a 4-year college to leave or anything. I'm the youngest of 4. Uh, so I was just planning on enrolling at a community college in my hometown and staying close to my parents, and got a job as a cashier at a local independent and really fell in love with the profession there. Seeing how the pharmacists interacted with the community, the whole family pharmacists interacting with the community, seeing the difference they had, but also having their work-life balance as well. That just really appealed to me. So that's really what started me with independent pharmacy to begin with, and then the ownership thing just kinda came by accident, I think.
Before we go into independent pharmacy practice, can you just define what is independent pharmacy practice and where does that fit in the world of pharmacy?
So, independent pharmacy practice, I'll use interchangeably with community pharmacy practice. So when people think retail pharmacy, they typically think of the chains, right? So all the things on social media and most independent pharmacy owners you'll talk to like to separate ourselves from that picture. So we're not reactive by any means in our interventions with the community. We're very proactive. We're intertwined with our community. Most pharmacy owners, they live in the communities that they serve. They know the people in depth, the families, the cultures, all of the services and providers in the area. So I would say we're more entwined with the community, and able
Mhm.
to kind of like branch out and connect versus, a chain, a retail pharmacy. They're more confined with their corporate, policies and procedures.
Yeah. Can you provide some examples of the unique ways that you can connect and have touch points with the community that maybe your, standardized retail chains can't?
Definitely. So, like right now, we're in the midst of flu shot season. And I know before the chains typically did off-site flu clinics, but now what I'm hearing from the feedback in my community here is that, their policies are changing. They're not able to offer them as freely as they were, or maybe they
Mhm.
need to be a little bit more strategic with who they offer it to. It's not like a walk-in basis, which they're probably feeling the same crunch we all are in the industry. But for me as an independent owner, I know my contracts. I know, the reimbursement models that I hold. So I know which communities, I can market to. I know my profit margins. So I can be selective, but also be more free to help my community. So this year we've had a couple more opportunities for us to go offsite and offer, flu shots, clinics to, like the town workers. I'm with the local nursing school, with the pharmacy school, offering offsite clinics to the students. I don't have to present to a board. I don't have to go through red tape. I'm the owner. So like I can just, it's just a matter of calling me and I'll say, yeah, we'll help you out.
Yeah, and I'm sure even your staff pharmacists have a different experience. They can just call you. If they have an idea, they can directly pass it to you because you are the owner.
Definitely. And not just my pharmacist, my staff, my technician, my interns, they come up with a lot of innovative ideas. And I welcome that. And they know I welcome that. So it's nice to have.
Over the past 20 years, how have you seen independent pharmacy practice change? Because a lot can happen in 5 years, let alone 2 decades, right? So, what have you seen change over your experience?
From the very beginning, I would say pharmacies now, the ones that are thriving, the independents, they are branching out from just dispensing a product. So no longer are we just, stuck to a bench to fill prescriptions. We've always kind of, went out and we've counseled, we've shown people how to use, their insulin pens. That's not changed. But what I will say is that payers and providers or legislators are realizing the impact of what pharmacists can really do. We've been better advocates for ourselves as a profession, so we have more opportunity to do things and get reimbursed for them outside of just dispensing a product. So, like us having the opportunity to have these conversations with third party payers and then show them data, which, us as a profession, it, community pharmacists, maybe retail pharmacists too. We're not very good at, putting down, our interventions and showing on paper because we're so like on the fly with everything.
And so that's helping the business model and independent pharmacies stay alive during a time when retail is exploding. And it's also increasing access to care for the patients and people in your community. Can you can you just share one or two services that you have seen introduced into the independent pharmacy realm that have you think have had the biggest impact on patient care?
Yeah. So my favorite right now, we started offering long-acting injectable medication administration. So I'm certified. I tend to see most of the patients at our site, but that's been really rewarding for me to see. And then talking with providers. So I tend to administer like antipsychotic medications. So it's
Hmm.
for people so they can live in the community, stay at work. They don't have to be admitted inpatient to get, stabilized on medication. So they've already done that part. Now they're out. They're on my MedSync list. I'll check in with them. So mine are monthly on a monthly basis. So every month I'll check in with them, see how they're doing, remind them for refills, order it in, set up their appointment. If they miss their appointment time, at the pharmacy, I'll call them. I know one of them rides the bus. I'll say, all right, well, just the bus is running late. Come on in anyways. I'll take care of you. And then on the flip side, talking to, just trying to get feedback from the psychiatric providers in my area, the local clinics who offer the same service and ask how their experiences is. And their biggest problem is they can't get patients to show up, right? The
Mm,
continuity of care. It's a lot harder to get to a clinic, but I'm a pharmacy in their community. They can ride the bus to
yeah.
get to me. So, and every one of my patients that are enrolled, they come in on time. The only time there's a lapse in their care is, if we can't get a prescription in time, maybe they missed an appointment. But other than that, like I'm helping coordinate their care and helping them, stay on track with compliance. So that's the biggest one, and then the other one is probably, so we started a long-term care at home service to our pharmacy at the beginning of the year. That's been really rewarding to see too, because not only are we helping the patient, the elderly patients or the disabled patients who qualify for this service, they're able to stay at home longer. They don't have to go to a facility. But now we're getting a reputation with the local clinic. The UNC geriatric heard about this service. The big hospital with discharges heard about this service. We're making it impact. The feedback's getting back to the providers and the nurses. And so now we're getting referrals. Like people are noticing the difference that we're doing. So it's rewarding for us because we're doing a good job and then we're keeping people happy and out of the healthcare system. We're saving them so much money with that.
That's awesome. And how long has this program been implemented and running?
So long-term care, I just enrolled, started that process beginning of 2025. And then the long-acting injectable, maybe going on 2 years of offering that service.
Okay, that's awesome. So within a year, word is already spreading
Mhm.
and referrals are picking up. That's amazing. I want to take it a step further. You just gave us two wonderful examples. One is more clinical, and the other one is access to medications and making it easier for them to stay adherent to their regimen.
Mhm.
Can you also go into other services that your pharmacy offers? Some of them are going to be pretty familiar to us, and then others might be nuanced, like terms like MedSync, like defining what that means
Gotcha.
exactly. And then also what is going on still in the standard storefront traditional arena, just for folks who still just don't have much of a background of what you're doing.
Yeah. So I'll start with our front end and then I'll work my way back. So our front end, I try to get in, of course, your typical first aid things, things you go to a pharmacy for, Band-Aids, wound care, stuff like that, Tylenol, ped stuff. And then I try to work with local farmers, local vendors to have more local products. So still like being in touch with my community, right? We have a farmer who's right here in Chapel Hill. Like, you can't get more local than that to where we're at. There's a couple miles down the road, there's a elderberry farm. So we buy elderberry extract from them, and that does really well in our front end. And
Wow.
there's a couple other clinics. So they offer drug-free lice treatment because we're close to schools, so we partner with them for that. And then just other vendors too, like there's a sticker company that we order from. There's a Raleigh potato chip company. So all of those things, being able to sell that. So that brings people in because we offer local products. And then moving to the back. So still we do traditional fills. So people need refills, people need antibiotic, quick fills. There's a vet office next to us. We do pet meds as well. And then going to the back further than that. So a couple of the services, screening stuff we do go along with what we're able to do in North Carolina. There's some standing orders. Pharmacists are able to prescribe and recommend products under our medical director for the state. So we do a lot of Narcan counseling. We actually have a partnership with a nonprofit in Timberlake, North Carolina. So we're able to get a grant-funded Narcan to hand out to folks where insurance doesn't cover it. A lot of insurances don't cover it, but a lot of pretty much everybody we counsel and talk about it who, it's warranted, they should probably think about it. They wanna get it after they talk to us. We're also a syringe service program. So again, with the same a nonprofit company, we, hand out needles, which that's controversial to some folks. But for us,
Boom.
I don't think about it any differently than, treating a patient with diabetes or hypertension. And it's just, how you were trained and what you're comfortable with. That's another service that
Mhm.
we offer. So MedSync, getting back to that, that's just kind of getting at the proactive thing. Most times in retail pharmacy, you take a pill, you take your maintenance pill, whatever that is. Your bottle's empty. What do? You dial it into the pharmacy, you call them, and then you fill it. So we take it a step further than that, especially if you're on multiple medications. And if you're on, a blood pressure med, a diabetes med, a cholesterol med, if you're on an expensive medication that we typically don't stock, we rope you into what we call MedSync. So now not only are you just dialing in your refills, now you're getting a pharmacist or a, a trained technician, certified technician at our store to go through, look at your medications, see if there's a new prescription that might have been called in. If you went to an office visit, got some blood work done, the doctor changed your dose, you never had that conversation. Maybe you didn't even know you needed to go up on your cholesterol med. We catch that now. We do a whole med rec. We go over it with you. We offer time to go over questions, um, contact your doctor if we need refill, maybe just answer some questions that weren't clear to them at their last office visit. We have time to research that, put it together. So that way they just come in, they pick up their meds and are on their way. So a lot of troubleshooting behind the scenes and then doing a clean med rec. on the back end proactively. And then same thing with the compliance packaging, still kind of the same process, coordinating care with caregivers and providers. Last thing, we have our immunization calendar. So we're taking appointments, ideally appointments for immunizations or for the long-acting injectable administration. And there's also time in there if they want to talk to the pharmacist. So this is more than just a quick question at counseling. Maybe you have a more in-depth question for us. I offer that in our appointment calendar. So we carve out time and the pharmacist doesn't feel rushed to talk to them about that.
That's amazing. Are you also doing any MTMs or CMRs?
Yes, definitely. There's so much stuff that we do. It's like it's hard to like think about them all in the same setting. But yeah, we do those too. Those are obviously paid and assigned to us from third parties. So those are definitely nice because we get reimbursed for our time. And then that's another place where we usually catch a lot of interventions with that. And then going along with that, we have a couple extra programs, mostly through Medicare, where we get paid from certain third party companies to ensure compliance.
Excuse me. I hope you don't mind if I cut in for a moment.
Hurry up.
Number one, thank you for watching. I hope you're learning something new in this episode. Number two, which is the reason I'm here, is if you don't mind, could you be so kind and like this video or hit the subscribe button?
I mean, I've always subscribed.
By subscribing, you're letting YouTube know that my content is providing you value, and that ultimately helps the channel grow and reach more people who need to hear these conversations. You can also subscribe to the Pharmacy Pathways newsletter to get access to exclusive episode content. Newsletters go out in the same week of the episode. You'll receive a structured summary of each interview, expanded guest bios, and exclusive sneak peeks of future episodes. Subscribe at pharmacypathways.org. Link is in the description. Oh, and one more thing.
Hurry up!
If there's a specific topic or career you'd like to see featured, you can let me know by filling out the audience feedback survey on my website. And if you'd like to be a guest, there's a guest sign-up form on my website as well. Both of those links are in the episode description. Okay, let's get you back to the show. With these sketches that you're getting with MedSync, and then with your ability to perform CMRs, do you have access to clinical data that allows you to be a little bit more pointed in your discussion, but being able to log on and see patient charts and labs?
Yes, that has been really huge for us. Like I said, we're really fortunate to be where we are because we're close to UNC and we're close to Duke. And with that, all of their clinics that are affiliated with Epic. So I can log in on the back end. I have access as a proxy through our pharmacy, and I can see all of their clinic notes. I can see their labs. I can't order things, but I mean, I can see all the notes from the clinic visit, the medication updates, the paper trails with that, and I can kind of bridge those gaps. I can even see, people think that their doctors send us prescriptions after discharge, and I can actually see, oh no, they sent it down the street to this pharmacy. And then sometimes they head on their way over there, and then sometimes we end up transferring it in because we were so helpful on the front end. But that's really huge.
With this level of operation, you named probably like 10 things that you're doing. How are your staff? And if you can also share like what type of staff you have, like maybe what is like the best supportive ratio of pharmacists to technicians to support this type of operation, and what does their day-to-day look like? How are they rotating through these different roles?
So I have it set up so I can have one pharmacist per 4 technicians. And we don't always staff like that, but worst case if we do have to do that. But a typical day, so Mondays and Tuesdays are usually our heaviest because we're closed on Sunday and only open a half day on Saturday. So Mondays and Tuesdays, I like to have 2 pharmacists staffing. We'll have our main front bench. So we'll have our checking pharmacist, our input technician, our filling technician. So they're over there, getting our normal routine, call-ins for the day. And then we have a dedicated cashier up front to help with that. And then we have one clinical team member in the back. So Mondays and Tuesdays, I usually have a pharmacist as that clinical person, just so they can help, check from the volume. Wednesdays and Thursdays, I'll usually have my technicians doing the clinical operations, the calls, putting together bubble packs. And then Fridays, I'll usually just come in as the clinical person, just to kind of tie up loose ends before the weekend. And that's usually how we staff during the week. And then Saturday, we're only open 4 hours. So I'll have one pharmacist, one technician, and one cashier. Ideally, the thought is we're so proactive during the week. Saturdays are really for your emergency fills and to pick
Yeah.
up things because you're working during the week.
Would you say that that's another difference to probably the experience of someone working in independent versus a retail? I know a lot of pharmacists personally who are a little bit stressed with the ratio that they're given to work with when it comes to technician support per one pharmacist. Do you know the average of what it usually is like in retail now?
I've heard of some locations staffing just one pharmacist for a 9 hour shift. They don't even get a technician. Hopefully, their volume isn't what I'm doing, but I can't comment on that. I don't know. And then
Yeah.
other places, maybe one pharmacist to two technicians, and then maybe they'll get a cashier. But a lot of multitasking, which isn't always safe. And then we also don't have a drive-through window at our location. So that's another thing, having to run to the front to have patients and then run over to the drive-through window. So that can be nerve-wracking and a big, opportunity for mistakes too.
Yeah, that is, I know that's a big concern with people who are in the retail setting right now, especially if they're in an area that is pretty populated with a lot of traffic. And to your point, we are now also considering that because we're more mainstream, we're likely getting more scripts per day. We have probably have more influx of people just walking into the store in general because of what they're supporting in the storefront and the other services they're offering. So I have heard that the independent pharmacy, just the environment itself, just provides a lot more relaxation that you can still do your job and also think clearly, less prone to mistakes, feeling like you have more support to really be more high level at executive functioning.
That's good to hear.
That has been something that has been consistent for me about the pros of working in the independent pharmacy arena. And you're echoing that through just what you're sharing. All right. But with that being said, we kind of started already talking about the next question. What are other things that people should be mindful of when they're deciding, well, do I want to work in independent or retail? What are the pros and cons of each arena?
So the biggest thing that I come across with interviewing, potential pharmacists too. So everybody wants to work at a independent, like you said. So every time I open a position, I get floods of people applying. The flip side is they're not willing to negotiate. Some of them aren't willing to negotiate the price point, right? So what that means is it's not, we're not going to underpay you grossly of what's, you know, out there.
Huh?
But, where you might be making, I don't know, $60 at a corporate chain, maybe the independent offers you, I don't know, 55. But you know what? That's also to split so you have staff to support you. Like everything that comes
Yeah.
in and out, it stays here at our store and in our community. So we're more mindful of that. So there's that. Um, there's also like sign on bonuses for a certain amount of time. Why do you think they're offering you that much money? Like talk to the people in the industry. Are they happy with it? Maybe their bank account's okay, but do they have time to spend it? How's their mental health? Do they have time for their family? I don't know the answer. I've never worked in a chain, but just things to consider. I'll say for me and my staff, I prioritize my family time. I have a family. I have two kids. I don't want to be at the pharmacy all the time. I want to be at home with my family when I'm off, when I'm on vacation. So, really respecting work-life balance and giving people a break when they're away from the pharmacy. We're closed for holidays. Like I said, we're closed on Sundays, half days on Saturdays. I'm still able to offer my employees, a healthcare plan. We have vision and dental. We have life insurance. We have disability. We're able to give them plenty of time off because I have so much staff that I can depend on and that are well trained. But yeah, just look at the whole picture. Don't just look at the price tag. You're still going to make a good amount.
Yeah. And addition to that is also, what do you value most in the community setting? Do you like kind of be hidden behind the scenes, just, verifying and checking and moving at a fast pace, or do you really value that time you get to get in front of a patient and have that one-on-one impact and those conversations? Because you may not have the same privilege to have a 15-minute patient block to just talk about one medication, right? In the fast-paced retail arena. So that also allows you to have a lot more hands-on patient counseling, interface, and building relationships.
Yeah, and our people need it. I mean, doctors and physicians, providers all around, they're getting less and less time to spend with patients. They're having to document more. They're getting burned out. They really depend on us in the community setting to kind of help bridge those gaps. And we do a really good job of that, and I enjoy that.
Yeah, and I'm sure it keeps them coming back because they feel like more than just a number.
Definitely.
I started my pharmacy experience in a retail store, but this was before things started shifting. And I just remember the my pharmacy manager, her ability to just step aside and talk to patients, even about how their dog is doing or their kid, had so much impact when it came to customer loyalty. Some of these people didn't even want to talk to anyone else. If she wasn't working that day, they were turning around and coming back
Oh
another
my
day.
gosh,
And
yes.
the relationship that it just established, but then I think sometimes that may be lost on the corporate side of things. They're not understanding how impactful that is with the relationship between the customer and how that translates to retention of business. I said earlier that I wanted to address some of the concerns that people might have potentially about the longevity of A, finding a job in an independent pharmacy, and then B, starting or owning an independent pharmacy. But I'm going to read from my paper because
Read
there's
it.
some numbers that I want to share. So, according to my research, nearly 1 in 3 US retail pharmacies have closed since 2010, with an overall closure rate of 29.4% between 2010 and 2021. And for independent pharmacies specifically, that loss was even more severe. Independent pharmacies had a 38.9% closure compared to chain pharmacies, which had 21.9%. Also, want to point, right, because we need to make sure we're including all data. Even despite these closures and consolidations, independent pharmacies still maintained a relatively stable share of the pharmacy market over the past decade, still maintaining about 35%. So when we're reading these numbers online, or they're being reported in a news article or the news, whatever it may be, we know as pharmacists who are trained to look at data statistics, the numbers can be skewed. They can be manipulated to get across a certain message that may not be presenting the full picture here. So I think you're an amazing person to talk about this because you have insight for someone who has seen this industry change over the past 20 years, and you're an owner of the pharmacy as well. So can you put some context to these numbers and these trends that this data is speaking to?
So I think one thing one thing if you're not really attuned to the industry, like independent pharmacy industry, you might think that it's maybe like the competition from the chain pharmacy itself is what's putting independents out of business. That's not what it is. Our best business model as an independent was to open up close to a chain pharmacy because we outperform them all the time with customer service. Just like you said, people get burnout. They don't like being treated that way. They don't like being rushed. And anymore, they don't like showing up to a pharmacy and they're not open because they couldn't get a pharmacist to staff. That's actually happened at one of the chains down the
Mhm.
road from us. It puts people into a panic. They want somebody that's dependable. They want a consistent staff. They want to be able to go and talk to, that one person, like you said, your pharmacy manager. So it's not competitions from the chain that's putting us out. What I will say is that this is controversial too, but with independent pharmacies, it's not controversial. This is just what we're used to in our industry. It's the pharmacy benefit managers. It's a lot of the third party companies, being able to grow in power, having these take it or leave it contracts, which us as pharmacists, we aren't trained as business people. You go through pharmacy school, you learn pharmacy. Maybe business is like an elective, maybe one lecture you hear about. So we're not trained to read these contracts. I had to do a lot of legwork in learning, researching on my own. Like you said, that's what we do as pharmacists. At least we're trained to do that. And then the other thing is we'll take these contracts that are very black and white, not in our favor, but why do we accept them? Because we don't want to miss out on a patient population, right? We're like, if we don't sign this contract, oh, then we're not going to be able to get this family. I know they have this insurance, they contract with this third party. If I don't accept this, then they can't come to me. So it's like, but yeah, but they can't come to you, but then nobody can come to you because you're going to go out of business. So I've
Yeah.
seen that sort of disconnect a lot with my colleagues and us just feeling so helpless for so long. What I really feel like the catalyst was COVID. You know, everybody shut down. Who was still open? The independent pharmacies. A lot of us independents, we couldn't survive before then because we were accepting these terrible contracts. We didn't really have anybody to help us out with that. Nobody to advocate for us. We didn't really do the best job advocating for ourselves. But then this pandemic hit, and then they're depending on everybody to, disperse this vaccine. Where's all the independents at? Well, they went out of business. They're not there. What are we going to do? So it was like everybody just kind of stopped and was like, oh man, maybe we should look into this. And for me, as far as like, my reality, what I noticed, I feel like that was the catalyst for us. And now we're starting to see, all of these, our legislators, our local legislators are interested in what we have to say. And on the national level, the Federal Trade Commission is looking and calling these, CEOs in and saying, like, can you explain yourselves? And they can't. So
Mm.
it's that's really what it is. Us being healthcare providers, not great business people, but that's really what kind of prompted me to try to start changing and seeing what's down the road ahead. How can I be proactive? This isn't this isn't going to be how we're going to last in this industry. What can I do to, improve healthcare of my community, for me to stay in my community so I can continue to help them, and then also support my staff too. If I go out of business, my whole staff's up the creek too. So I have a lot of people depending on me to motivate me.
This isn't a question that I prepared in advance, but I am curious. How do independent pharmacists establish their voice? How do you get your opinions all the way up the pipeline? How are you getting it to the people who are responsible for overseeing the contracts and putting the regulations in place?
So for me, like really, you don't even have to get fancy with it. We had a legislative day in North Carolina. Probably other states do the same thing too. So I'm a member of our state organization. Really, that's the best way for me for the pharmacy profession. I feel like to be stay on top of, what's on the table as far as what's related to me, my practice. So really joining my state level pharmacy association. And then we just literally walk into, the legislator office, the representative's office. We found, who represents our community, and it was just, "Hey, I'm Keiko. I practice in your district. Let me tell you about this, House bill that's on the plate, and let me tell you how it impacts our community." But, I mean, we do this all the time in independent pharmacy practice. It's a conversation with your people. You know your community. It's as easy as that. But I think people get intimidated. And I was one of them for so long. How do you even start this conversation? But they are there to represent you. That's how you have to think about it. And if they don't know what's going on in your community, then they're not going to be able to help you.
Yeah, I feel like we're indoctrinated in this mindset of we're not respected as pharmacists. We go to, 4-year doctorate school. We even do residencies and fellowships, and we are doctors. We are
Mhm.
experts of medications, but yet we are fighting for things like prescribing. The actual expert of medication has to fight to have the ability to prescribe it. And so we're just I feel like we are indoctrinated with this belief of we're not respected, we don't have as much power, or our voice isn't as loud, it's not as heard. And I think that subconsciously makes you become mute or take on that belief that there's no point in me speaking up because I'm not going to be heard. It's not going to matter at the end of the day. And I think that just perpetuates the cycle. Shameless episode plug. I have an episode on pharmacy advocacy that is literally talking about the importance of pharmacists joining their state organizations for this very reason. So to hear you to say that, music to my ears. When I asked the question, I wasn't sure if you were a member or not. I was curious, but
Yep.
thank you for sharing that because it's just another reminder of what happens when we actually don't voice our opinions. There has to be somebody who takes that to the next level and up the pipeline.
And I'll say we as female, we do that to ourselves too. So this is the era for us to speak up and advocate.
I love to hear that you're getting involved with your state, that you're attending these meetings when the opportunity presents itself, and that you're also learning how to read these contracts so you're not getting blindsided by what you don't know. And then that empowers you to actually make changes. Where do you see independent pharmacy going in the next 3 to 5 years, or even 10 years if you can see that far out?
Yeah, I definitely see us expanding. Well, here in North Carolina, we just got some legislation passed to expand pharmacy practice. So I'm pretty excited to see where that will go, giving me as a community pharmacist the ability to contract with the provider. I can practice as a CPP. It was a lot of red tape with that before. You had to be in the practice, like you had to be an ambulatory care pharmacist in a clinic. Now it seems like it's being rewritten to where I can do that, not, you know, physically under that clinic roof, but having that relationship, which I already have, and like making these changes, these formulary changes, certain things under this written protocol with my local providers. And I can do that because I'm the pharmacist. I don't have to ask permission so much. I can just do that because we have that mutual respect for each other. There's a test to treat uh, bill that was just approved too. So testing for flu right in the midst of flu season. I can test in house. I can prescribe, treatment for it. We're keeping the sick people out of the doctor's offices so they can focus on preventative care too. But it's not like we're not doing it to step on providers' toes. We're doing it to help each other because that's just the way the industry is. We don't have time to do things. So why don't we all help each other out? Let pharmacists do what pharmacists are good at. I'll keep people compliant. I'll do all those things.
I love that. Yeah, I think almost every healthcare profession is experiencing burnout. And so if we can share that responsibility, offload each other, I think we could really, really just alleviate the profession in general. For pharmacists and student candidates who are pursuing this track and they want to get their foot in the door, what is a way that they can begin this process? If you had to give advice for somebody on how they can pivot into this industry, what would you say to them?
The easiest way is so ridiculously easy. Just go find an independent owner, tell them you're interested in it. They will talk your ear off about it. Now, depending on which one you go talk to, maybe they'll be more, pessimistic about things. Maybe they'll lecture you, like very angrily. But otherwise, go to one that seems like they're thriving. There's podcasts all over the place, just like yours. I hope to share my information too if anybody's listening. I'm always happy to help. I like to, get people motivated about the profession. I really like what we do. I think there is a role for community pharmacies. I like to share that with students. I love that the pharmacy school is reaching out to me, asking me to talk to, the next generation of pharmacists about this in a positive light. That's really exciting for me because I don't know if I had that when I was coming through. I don't know what your experience was with that either, but there weren't very much of us, coming through the pharmacy doors. It was more like clinical focus and research focus and all like the cool, sexy pharmacy things like that. Having the opportunity to breathe new life into it and then challenge these new pharmacy students. Hey, bring your ideas. You guys are a lot smarter than us. You're more tech savvy. You're bringing the solutions to help us all out. Don't let us die off. Our community needs us. Bring your innovations to help us out.
So if I had to summarize your advice into bullet points, get on Google, identify an independent pharmacy near
Independent
you,
pharmacy near me.
and walk in there. Yeah, or you can even call ahead and say, hey, I want to have this conversation. When's the best time for me to stop
Yeah.
by?
Do an email. Most of us have a website.
Emailing,
Mhm.
LinkedIn. I think LinkedIn is a great place to reach out to people you have never met before because they can verify that you're not a crazy and you are a real person who's pursuing pharmacy. And then utilizing their resources, their technology resources, they can watch this podcast in particular, but they also can watch others. There are other people who are putting information on the internet about what this experience is like.
Yes. There's tons of forward-thinking independent owners all around the world or the US. Yeah, they're everywhere.
Is there like a public webpage where people can check out like what's going on in independent pharmacy? I'm just curious.
So if you Google flip the pharmacy, that pretty much gives you the roadmap. All the current independents who aren't doing these next level processes in their pharmacies. If you're just filling still, if you haven't even started immunizing yet, flip the pharmacy is a really good roadmap to start that process and kind of build your SaaS and your operations to that. Probably to get a handle, probably the most robust, forward-thinking, independent pharmacy owners, in my opinion, this is kind of putting a plug for our pharmacy management software, but they invite really good forward-thinking independents, is a Catalyst podcast. So that's through my pharmacy management system, Pioneer RX. They have independent owners who are doing really cool things. I listen to it occasionally just to bounce ideas, um, kind of get new ideas for things, see how other pharmacies are doing it. That's a good one I would recommend. The APHA president right now, Randy McDonough, he's really cool. In my opinion, he's really forward thinking too with independent pharmacy. He kind of started this whole blueprint for this appointment based model for how I'm doing my operations and how a lot of the independents are doing their operation to offer these clinical services.
That is amazing. So they have a lot of great resources now. They have things that they can literally start doing today, next day, next week. Before we wrap up, is there anything else that you would like to share with those who are more so focused at this time, getting into a staff position, internship, shadowing position at an independent pharmacy?
If you really are interested in it, I would say go in with an open mind. Don't be afraid to ask questions. And independent pharmacy owners, we try to be organized, but we're not the best at it. We don't have like lists and check boxes for you to go by. So be open to the experience, be self-directed. If you're seeing something you want to know more about, just ask. I like it because I don't know what my students, my learners are thinking. I know it. I do it 1,000 times, but that's how I learned. If you're really genuine about it, we'll share everything because we want to inspire the next generation too. We got to have somebody to sell to. We don't want to sell out or go out of business. So I'm looking for my next buyer too.
All right. So independent pharmacists are looking for people who are interested to pass the torch, to work alongside them. And it sounds like specifically they are in need of innovative thinkers. This new generation that's coming up, your skill sets, your knowledge is very, very much needed. All right. And so for those who want to connect with you,
You can reach out through the business email. So if you want to Google our website, it's carboroughfamilypharmacy.com. Browse all of our pictures, read our stories, and then there's a contact page. If you want to fill that out, that'll go straight to my work email.
are awesome. So I'll actually put the link in the description so they can just click right on there. I want to thank everybody for joining us for part one. We are now going to continue the conversation. It's going to be geared more towards pharmacy owners, those who are actively owning a pharmacy, who are scratching their heads, figuring out how do I financially revive my store? How do I get ahead? Or how do I just take it to the next level, even if I'm already doing well? And also those who have their eye on becoming an owner one day. So we are going to answer those questions specifically in the next episode. We will see you there. Thank you, everybody. Stay blessed and stay curious. We are out. You just watched an episode of Pharmacy Pathways, a podcast created to help current and future pharmacists find their happy place in life. I'm your host, DomThePharmacist, and I interview different pharmacists from various careers, asking them the questions you'll likely need answered in order to know if that particular role aligns with your interests, passions, skill sets, and talents. If there's a specific topic or career you'd like to see featured, you can let me know by filling out the audience feedback survey on my website. And if you'd like to be a guest, there's a guest sign-up form on my website as well. Both of those links are in the episode description. Thank you for watching. Stay blessed and stay curious. I'm out.